My name's Kiran, I'm a senior refractive optometrist for Optical Express and I've been working here for 15 years now. I've always wanted laser eye surgery and I've been a contact lens wearer for over 20 years now, but with that comes its own issue, dry eye, infection, but I have toned down the use of my contact lenses and I am now a suitable candidate for surgery. My main motivation for having the surgery is I just want to be able to get up and see. I'm quite short-sighted, I'm about a -5.5, which means I can't see from about here onwards. So just to be able to see the end of the room, my kids coming into the room, that is pure motivation for me. I do jog 4 times a week, I go to the gym and it is a pain having to wear glasses, especially when jogging outside when it's raining and inside now with having to wear masks and glasses steaming up, so yeah, a lot of hassle. My manager has had the treatment done and a couple of the optometrists that I work alongside have also had the treatment done and they've all said nothing to worry about, nothing to be nervous about and you won't feel a thing. So without my glasses I can't see to drive, I can't go jogging, even doing my job on a daily basis, testing people's eyes would be difficult. In my role as a refractive optometrist, I have to perform consultations for patients before surgery, so I see a wide variety of patients and it would be good to be able to give a first-hand account of the day of the surgery, the recovery of the treatment and be able to empathise with the patients. On a daily basis, it's my job to convey to patients the major benefits of having refractive surgery over glasses wear or contact lens wear. For example, many of our patients are unaware that there's a much higher risk of getting infection with contact lens wear than there is with refractive surgery. On the day of my surgery, I remember waking up, I was very strangely excited for the procedure, not really nervous. I think I wanted to see what it was like from the other side. So I came in for the surgery itself and I was treated like a patient, so which was quite strange because my colleagues were having to look after me for a change, which was quite nice. So when I walked in, I was actually asked to take a seat in the waiting area with the rest of the patients, which was quite strange, but it was good to see it from their point of view. And you realise that, you know, nerves do kick in, you do get a little bit anxious before the treatment, but I was still more excited than nervous. But it was nice to see patients that I had actually seen for the consultations which were in the waiting area with me, so it was quite nice to have that chat with them and I hope I put them at ease too. So I talk about this procedure day in and day out with my patients. I knew exactly what to expect, but even when I sat up after the procedure had finished, I think the first thing I said was, "Is that it?" I didn't expect it to be quite as painless and definitely not as quick as it was, and I could actually see straight away, which I know I say to my patients all the time, you will be able to get up and see, but yeah, it's true, I could see. I think my colleagues are extremely happy that I've had the treatment done. I think it's possible that they were more excited than me on the day of the surgery. They're probably happy that I'll stop going on and on about it now, but I am still talking about it. I had it done over a month ago now and I'm still talking about how good my vision is pretty much every day. I feel like I'm taking it for granted now, but one of the things that I wanted most was to be able to just wake up and see, to be able to not have to reach for my glasses, just see across the room. And I think I've almost forgotten that that's actually a normal thing now, that I can see. I don't have to reach for my glasses in the morning. I can fall asleep reading a book or watching the TV, not a problem. My vision now is amazing. It's better than it was with my contact lenses in, and I do understand when my patients say that they compare their vision often to like a HD vision. I understand that now. I remember I was able to drive the next day. Driving was not an issue for me at all. I did get a little bit of dry eye, but that was expected. Oh yeah, I'm most looking forward to going on holiday still. I mean, I have actually got a holiday booked for a couple of weeks' time, and it will be amazing to not have to carry contact lenses, glasses, prescription sunglasses, all of the things that I used to have a separate bag for. Don't need that anymore. So having had the surgery now, it is easier to talk to patients. I do see patients day in, day out for their consultations, and I do feel that once they know that I've had the surgery, they tend to open up a bit more, ask me a bit more about the procedure itself, and I'm able to tell them honestly what actually happened for me and my experience. So it is easier.